Hello to our Facebook Live. Again, as I introduced earlier, this is Dr. Olah. She is the Timeless Skin Solutions Medical Director, as well as the lead physician here in New Albany. And this is Brianna, one of our Timeless Insiders. We're happy to have her. This is a first-time filler for her, so we're excited. Dr. Olah, do you want to talk a little bit about what you guys discussed and what you're going to be doing today with Brianna?
Yeah, that'd be great.
I'm going to come closer because we got feedback yesterday that it's kind of hard to hear us through the masks.
Yes,
so I'm going to stay close with Dr. Olah.
So Brianna and I discussed she would like for us to look at lips today. So we talked about kind of her desired goals. Do we want a little bit of fullness upper and lower? Do we want kind of the lips to taper a little differently? As well as, I suggested we kind of support the corners of the mouth just ever so slightly because that does kind of help frame her face. We also discussed just in general, just to kind of talk about fillers in general, where do we put fillers? We often will put fillers here along the line that can be created here, as well as the lines that we can get as we age here. Our favorite place to put filler is right along that cheekbone here to provide a lift to the face. And we love to do that as well to assist in, Brianna doesn't have any of this, but to assist in gelling. We also love to create the jawline, really create a nice defined jawline right along here and also back in here, which provides a lovely lift. And really to work on those folks who get those fine smile lines to kind of help pull back, as well as sometimes in here to again give us that pull back and lift, as well as if we have any issues with the temples as we age. Sometimes we'll see some hollowing in there. We love to fill the temples because as you fill those, it does give a lift to the eyebrow in the corner of the eye. So lots of different areas that we can place filler. Specifically today, we're going to work on Brianna's lips. She doesn't want lots of volume. She just wants a little bit more volume, which is easy and fun to do because we are doing a Facebook Live, but really every patient is offered this. We can do a dental block where we do some nerve block inside, but that does involve a needle going inside the mouth. Some folks don't like that idea, obviously. So mainly for, I'd say 95% of our patients, we do a topical lidocaine as well as ice, which helps with bruising and numbing as well. And she will be great.
Awesome. Dr. Olah, one of the most common questions we get are how long do fillers last?
So, interestingly different for every person, but especially in this region, because we're moving this region so much, anywhere from 9 to 12 months is the average. Different in different parts of the face, because again, areas where we're moving those muscles, moving the lips more often, that is the filler can break down a little bit quicker in those areas.
And is this a long appointment?
I'd say about a half hour.
Perfect. So what that tells us is it's an easy get in and get out appointment. You can come over your lunchtime hour. We have early morning hours as well. So it really is a quick appointment once we've done the assessment. I think that's it for the questions right now. So we're going to let you guys get started on Brianna's lips.
Awesome. I'm just going to change my gloves. Brianna's already been cleansed. We will do one more surgical grade preparation cleaning.
And again, if anybody has questions, just post them there on our Facebook Live, and we'll make sure we get those answered for you. This is such a popular treatment right now, and we're having fun with it because it's a nice time to, if we have these masks on, what a perfect time to be behind the masks. As Dr. Olah mentioned, while there isn't really downtime with filler because we are using a needle, there is risk of some bruising and swelling. So what a great time when we're wearing these masks to get your lips ready. Also great time to treat around the eyes since that's what we're seeing so much of.
So we've already done an assessment with Brianna. We had a mirror where we talked through kind of what our plan was for injecting her lips. We also discussed that she has not had any dental work, has not had any sort of infection over the past 2 weeks. So we know that we're safe and we're able to go ahead and do the injection. Ready?
Yeah.
Okay. All right. Do you want any little anything to hold in your hands while we're doing this?
I should be good.
Okay. All right. She's brave. She's brave. She's happy and ready to go. Ready? Might feel a little poke. A little poke. So start by just creating a little bit of volume on one side. What we also discussed with Brianna was we will do half and kind of pause and show her the results. And then that also allows her to have some understanding of what we're going to do. We talked to Brianna about just kind of framing her lip a little bit and giving a lift right here, which is a look I love. I think it helps kind of frame those lips. You can see that just kind of helps create that little peak right there. And then we'll just do just a little bit of massage here.
There's a question that came in. How has Brianna been numbed?
Generally we do topical numbing and ice. If needed, we can do a dental block. We have many patients that have experienced both, and most feel very comfortable with just the topical numbing and the ice. So we've done a little bit on one side. We'll go ahead and pause and have Brianna take a look and see what she thinks. After I massage just a little bit.
Yeah, it's natural for the
Doesn't
eyes.
hurt. Just feels like a pinch.
So see how we have the lips kind of coming all the way out here a little bit, and then we'll massage a little more and create that fullness all the way across. Okay.
Yeah, that's good.
Do you like that? Just a little bit more volume.
Yeah.
You want a little more, or do you like that where we're at?
Maybe a little.
A little more. Okay. All right. So with Brianna, what we can see is we've really elevated her peak in the midline, and we've extended this lip border all the way out. Just a little bit to kind of solidify the corner of our mouth, I think, is another technique that we just don't always think about.
Christy, you can probably answer this question. Is
Sure.
bruising, swelling normal after treatment, and if so, for how long?
Bruising and swelling are normal after this treatment. Generally, bruising can last up to, I would say, a week. Swelling goes down sooner. One of the things I often find interesting, particularly with the lips, when we treat the lips, we get that bit of swelling, and then as the patients really enjoy the look, sometimes when the swelling goes down, they're ready to get a little bit more lip filler.
Very true. Very true. It's a good way to assess, do we want a little more?
Yeah, filler is absolutely one of my favorite treatments. It has little to no downtime, really, except for that potential swelling and bruising. And you get that instant result.
Open your mouth just.
The cheekbones, the hollows in the temple, the under the eye, the jawline, as Dr. Olah was describing. It just sculpts the face in such a way that you just look refreshed, but it's not a huge change where you look completely different. It's just a really nice, refreshed look. You can take a look at some of our before and after pictures online, and you'll see the subtle changes. The nasolabial folds, those parentheses around the mouth, very popular area to treat. We often get asked as well, how many syringes can I expect to use? As you can see, Dr. Olah has the filler syringe in her hand. Most often, patients for full correction are going to see that they're going to need multiple syringes of filler. One of the things we tell some of our patients, particularly if they're just starting out, that you can think about the number, your age. So say I'm 50 and I'm starting new with filler. The amount of volume loss that I could have at that time if I've not been treated before you could expect to use up to 5 syringes of filler. So it's number of syringes of filler per decade of your life. So, for example, Brianna's starting early, which is great. We love to see that. But filler's just such a wonderful treatment. One of my favorites.
Beautiful. They look great.
I do, yeah.
You
And
doing
Brianna
okay?
had, she had such a beautiful shaped lip already, and this just really accentuates it.
Won't fall, never mind.
How do you feel, Brianna?
Feel good. I don't
Good?
really feel much.
Yeah, good.
Yeah, just pinches.
Yes.
Yeah, not as scary as you think.
It is. It's the anticipation I always find is worse, and I've done it many times.
Yeah.
Because people don't want to look extremely different. They just want that enhanced version of themselves.
That is, we're going to go a little bit more volume down
Question
here.
is,
And then I'm gonna
do you do
secure
just the lip flip as well?
So a lip flip, we do the lip flip.
just to fill out that
Often we do it with
What do you think, Molly? Are
Botox
you
though.
happy
So
with-
what Dr. Olah is doing now is filling the volume of the lip. But a lip flip, the true kind of what you'll see out on social media when people talk about the lip flip, it's actually a little bit of the Botox, the neurotoxin just above the lip, and it allows your lip to flip up a little bit. It exposes more of the lip area, and we do absolutely offer that at Timeless.
How long does the treatment last before you have to come back and have more? I know you mentioned 9 to 12 months.
Yes, and what we find often, and Dr. Olah, correct me if I'm wrong here because you're directly forward facing with the patients, but because in the mouth area it's moving a lot, so it does break down the filler more quickly, we often too see that as patients start to restore that lost volume, they find that they want to come in for retreat anywhere from 6 months and on.
We recommend that all of our filler patients see us every 6 months, no matter what area that we're doing. Because again, if we start out with maximal correction for the first appointment, then perhaps in 6 months, we add just a little bit more to maintain the look that we've created, rather than to get back to kind of our baseline. It's just a way to kind of provide a little check every 6 months, do what we need to do, and then we can make any changes every 6 months on a good cadence.
And can you talk about, Dr. Olah, my area of concern when I first started with filler were the parentheses around the mouth. And we've treated those multiple times over the years. But each time we've retreated, we've not had to do it as soon, as 6 months. It's extended each time. Can you talk about that a little bit?
Well, I think there's a couple things that play into that. There is a little bit of our body's own ability to, our body reacts a little bit to the filler, so we do have some of our own collagen stimulation that kind of upholds that filler. But also, we'll talk about great skincare products, which increase the health of the skin. We can do other treatments, especially with those parenthesis lines or those smile lines, where again we're creating or working on stimulating your own collagen.
Mm-hmm.
So often we will fill first to correct, and then continue to work on stimulating your own collagen. I think the smile lines are interesting in that often, if we would have them right here, often they're very difficult to fill. But with the smile lines especially, we love to kind of fill using a volumizing filler back here, which then helps pull back and creates such a lovely look, as well as works on those smile lines. You don't have any of those things.
One day.
Perfect. Well, thank you so much for allowing us to come into the treatment. We're going to step out and let you guys finish up.
We're just going to add a little bit more
They
on
do,
the bottom
yeah.
line and a little bit right here, and we'll be done.
All right.
Loving it.
Perfect.
Thank you guys.